Okay, hello dear doctors, nurses and healthcare team. How are you today? Here we are going to evaluate next question about cardiology. Okay, a 22-year-old male athlete has been having frequent fainting attacks since childhood. He has no family history of sudden death or arrhythmias. His ECG demonstrates a sinus rhythm with normal PR and QRS intervals but a prolonged QT interval. The ECG is normal, but QT interval is prolonged. What is the cause of his fainting? A. Asystole. B. Complete heart block. C. Atrial fibrillation. D. Polymorphic ventricular tachycardia. E. Sixth syndrome. And we must note that the patient's fainting attacks is during their activity. He is athlete, and we are going to explain its polymorphic ventricular tachycardia, and we are going to explain it why it's polymorphic ventricular tachycardia. Okay, a polymorphic ventricular tachycardia is when there are beat-to-beat variation with no uniform pattern of ventricular contraction. This is also known as Torsades de Pointes. As we can see here, this is an ECG of polymorphic ventricular tachycardia or Torsades de Pointes. We can see beat-to-beat variation here, and there is no any uniform pattern of ventricular contraction. This is the specification of Torsades de Pointes. Okay. Remember, the ECG being described is on at rest. The patient ECG was on rest, not during the fainting episode when QRS would be brought due to their ventricular tachycardia. Okay? Prolonged QT syndrome is when the QT interval is abnormally long, predisposing individuals to ventricular arrhythmias, particularly Torsades de Pointes, syncope, and sudden death. Okay, we are going to evaluate the rest of the cases. Okay, there are no presyncope symptoms before fainting, which exercise, stress, medications, and electrolyte abnormalities can exacerbate. As we said, the patient's ECG was at rest, but there are no presyncope symptoms before fainting, which exercise, stress, medications, and electrolyte abnormalities can exacerbate the situation. Okay, what about sixth syndrome? Okay, sixth syndrome is a group of conditions affecting the function of the sinoatrial node. It's usually associated with periods of sinus bradycardia, tachybrady syndrome, atrial fibrillation, or flutter, but it's not associated with a prolonged QT interval. And this is an important note which is mentioned in the question. Sixth syndrome is not associated with a prolonged QT interval. Okay, the ECG demonstrates a sinus rhythm, which is not typically seen in complete heart block. As we said, in complete heart block, the P wave are not associated with the QRS complexes. In complete heart block, we have P waves, QRS complexes, but there is no any connection between P waves and QRS complexes. The atria are working separately from the ventricles. Okay, asystole is not associated with a prolonged QT interval. Atrial fibrillation does not lead to fainting. Why atrial fibrillation does not lead to fainting? Because atria only contribute to 15% of the overall blood ejected from their ventricle. Okay, here we can see another ECG which is showing polymorphic ventricular tachycardia or Torsades de Pointes. We have beat-to-beat variation without any uniform pattern of ventricular contraction. In both ECGs, there is no any uniform pattern of ventricular contraction. Thank you for your attention.